Hi there, Andrew with Zang Physical Therapy here, and what I want to talk about today is something that is very important for anyone who has any kind of orthopedic or muscle or joint issue, and that is an image of your body or an X-ray, an MRI, a CT scan does not tell the whole story. And it doesn't tell the whole story because a lot of times what you see on a picture is a one-time snapshot of your body. What you're like when you're laying on that table, in that tube, or standing in front of that machine. All right? That doesn't say how your body and your joints are going to move and behave later that day, tomorrow, next week. And quite frankly, what happened 2 hours before you had that test may look quite different because this is a static picture. It is not how we move and function. And the other important thing to keep in mind is that more and more we're finding out through scientific research, and doctors are admitting this, that when they do surgery, they're looking at some kind of anatomical variant. And they're finding that that anatomical variant, quote, variant that they see on image doesn't necessarily correlate with the person's pain problem. All right? Let that sink in for a moment. What you see on image doesn't necessarily equal pain. Now, this is different than most people want to think or have been told because medical establishment, and this has been fed by doctors and radiologists and physical therapists and chiropractors and you name it, the medical profession has perpetuated this belief that everything that doesn't look perfect is a reason or a culprit for why somebody's in pain. But like I said, we're finding out that that just isn't true. The doctor that goes in there and removes that tiny rotator cuff tear, and then the person has more pain, well, that tiny rotator cuff tear has been there for months or years, and you were just fine. It just so happened it became symptomatic. They took a picture of the shoulder, and then they went and did surgery. That little tiny bulge in your spine, be it your neck or your lower back, that's probably been there for quite a while because you're 50 years old, you're 60 years old, and you lived with that for maybe 20 or more years, okay, and you were just fine. But yet a doctor saw it on an image and said, yep, that's your problem. So he goes in there, he cuts it out, and when you wake up on the other side, you're in more pain, you have more trouble doing activities of daily living, your frustration mounts, and you just don't know where to turn, and then you start taking pills, and then more pills, and then you're addicted to pills. And by this point, you don't know what to do. You don't know where to turn, who to trust. And this is a very bad thing in our medical system and is one that we are really, really working hard and trying to correct. But it all starts with you, the person, understanding and realizing that you don't need to push a doctor for an image of your body. Yes, there are specific reasons that you may, in fact, need to have an x-ray. You may, in fact, need to have an MRI. But the doctor should be able to make that call themselves. You shouldn't be the one pushing it. Again, there are very specific instances in regards to your lower back I'll talk about real briefly. Should you start to have foot drop and you can't control your foot and you're tripping, that's probably a reason to have a test. If you start having bowel or bladder problems, that is probably a reason to have it. If you start waking up in the middle of the night with excruciating pain that does not change regardless of position or movement, maybe they want to look at you in that instant. Outside of those instances and a few other ones, and these will be specific to a various body part, mind you, a doctor should be able to make a judgment call whether you need it or not. And if you see a physical therapist or someone like me, we're going to tell you the same thing. In most cases, unless you are having or extreme circumstances, it's not going to change how anybody treats you. Okay? The only reason, or the only thing that's going to happen is if you have an image, is you're one step closer to having a needle or an injection done, or having a knife or surgery done. Outside of that, it's not going to change what any massage therapist will do, any chiropractor will do, any physical therapist will do from a conservative standpoint. Our goal is to try to learn how you move how you function, what you can do, what you can't do, and then create a solution to your problem. Oftentimes that is working with you hand in hand to help you achieve your goals. And again, that image isn't necessary. I have patients come in almost every single day. Yeah, doctor, did this test. Do you want to see my image? It's all well and good. It helps me to learn more human anatomy, but it doesn't help me one bit to treat you. It just doesn't. If you fail with someone like me, um, and things just aren't changing, then by all means, a doctor may consider some more advanced imaging or workup. But really what that's going to do is just take you towards things that you don't want. Injections, needles, pills, the psychological stress. And that is a key thing that I didn't touch on enough. Once you start to know that you have um, some tiny abnormality, as the medical society calls it, that weighs on people really heavily, to the point where it causes anxiety and stress, and that actually can amp up the pain response that somebody is having. So let's take a step back. Let's try to use conservative measures first and foremost, and let's try to keep you from having images, because when it comes down to it, the radiation you get isn't helpful. It's not going to change anything. The psychological stress isn't going to be anything good for you. And then in the end, it takes you towards, again, pills, surgery, injections, things that you don't want. So if you're looking for another solution, if you're looking for a way to heal your body more naturally and get yourself moving right, then get yourself to a physical therapist or somebody who can do the hands-on treatment that you need, that you want, that is going to get you there. So I hope that this was helpful for you to understand why an image doesn't tell the whole story. I want your story, not a one-time picture. If you have any questions, please leave it in the comment box. Please shoot me an email, andrew@zangpt.com. And I hope just to be able to educate you further and to be just one small piece in the process to get you back to doing what you enjoy and what you love. Have a nice day.